Hi there! In this video I'll show you the first 5 exercises you need to do if you are after surgery from disc herniation or any lower back problems. The first 5, remember, if you cannot do those, you cannot do anything else. Let's get started. You need to wait 30 seconds more before we start the exercises because I have few important things to tell you. First, when you can start doing them. Immediately. If you can stand and walk, you can do them. Even few of them you can do in bed even without the power to stand up. Second thing, what exercises should you do if you don't do them? Those that I will show you are the first steps. You need to gain control of the muscles. The first exercise you need to start, doesn't matter if it will be those or other, has to be for the control of the muscle. Not for pain relief and feeling better, but for muscle control. This will give you the backbone and you can improve over time because of those. So let's get started with the first one. I'm sure that I showed you this exercise before some time, but believe me, this is the most important one. When you lay on the floor, just try to squeeze the abs. You need to pull the ribs down. You can see now how the rib cage is lifted up in the air like that. This is compensation, and the more your chest is up, that means less abs activation. We need to change that. Just push the ribs down. In the beginning, you can see it looks easy, but when you do that, it will be hard as hell. Yes, I know that the doctor said no crunches, but this isn't a crunch. This is ab control. If you cannot do that, you can try to push with the hands to the chest. Just like that, slowly pushing and squeezing the abs. Don't bloat your abs. When you're squeezing, don't make it like a balloon. You need to take a little breath and take them in and squeeze. In that case, you engage the abs nicely and you won't make some problems after some time. The next thing that it will be helpful for you is just lifting little from the floor like that. You can see the same movement here, but it's like a little compensation from the shoulders and the head. Mostly from the shoulders. You don't need to tuck inside your head. So when you squeeze, you can see how the ribs are gone. You cannot see them. When you get the rest down, you can see the flare. The idea is the flare of the ribs to be gone. You lift, squeeze the abs, and then try to rest the head and the shoulders. If you cannot do that, take a pillow or anything that you can put under the head and do the stuff again. Let me show you a few reps without using any compensation, just the movement. Ribs up, the flare, and then squeezing them down. Up and down. The other thing you can do to make it easier is to breathe out when you squeeze the abs. It will get you to the movement. It will get better. The second exercise is again in this position, but first I want to tell you that twisting and bending after surgery isn't a good idea. You need to gain control. Those that I will show you are hip rotations. You don't need to make them hard. You don't need to go for full range of motion. The idea is to gain control just from the movement. So let's get down and see what's going on. Again, the same thing. You need to pull the ribs down and the abs to be locked. You don't have to move the upper body. This movement is only from the hips. So just go anterior pelvic tilt, posterior pelvic tilt. Slow movements, control them. If you can see, this is my full range of motion. Do you have to do it like that? Of course no. The idea is to make it slow, little reps, with little movement, just like that. In the beginning, even without seeing any movement is enough. Just little by little, every exercise, every day, add a little to the range of motion. Your muscles are tight. If you push hard, they will spasm and you will say that the exercise is bad for you. No, the way you do it it's bad for you. I know all of you guys know the cat and cow, so I will show you something better. And if you don't know why it's better, you need to check this video above me about the cat and cow and why it's a mistake to do just that. So let's get on the floor and be on the knees. Here you need to lock the upper back. The upper back shouldn't move at all. Again, everything comes from the hips, up and down. The idea again, ab squeeze and rotation. If you get control of those, even bending will be a good idea after some time, because you will know how to hip hinge and control the hips. The fourth exercise is about gaining muscle strength to your glutes. Why you need glutes when you have back problems? Because the first and maybe most important thing is that weak glutes are causing lower back pain, because the lower back gets tight and overworked because the glute isn't working properly. So let's get some strength and feel better. The glute bridges. Of course, if you don't know, if you're not sure how to make glute bridges correctly, I covered that in one more video about me, that every step by step, every little step that you need to make to be the perfect glute bridge is there. So check it out after watching this video. When you start, again, squeezing the abs and making yourself in posterior pelvic tilt. This is the neutral when you're on the floor. There shouldn't be a hole underneath you. Now slowly go up till there is a straight line to your shoulders, hips and knees. The biggest mistake here is losing the control of your hips, of that posterior tilt from the bottom, and the ab control. It's looking like that and it's nasty. The idea is the butt to be tucked in and the abs as well. The ribs should be down. The straight line has to be perfect. The more anterior tilt you're doing, the less glute activation you have, the less ab activation you have, and the more you're hitting your lower back that is hurting. Same with the abs. The more up is your chest, the more pressure on your spine and muscles of the back, and less on the abs and the glutes. So if you know how to do the first and the second exercise with good form, that means even exercise number 4 can be done perfectly. This is why I'm telling you, everything is in the control. If you have control over every part of your body and you can make one exercise bad and good, only with that control, that's the only thing you need. The fifth and the last exercise is for some other part. It's your thoracic spine and of course hip control as well. A lot of people are seeing that scorpion move, and for me it's really bad movement, because your lower part here, the lower back, isn't made for twisting and bending. Yes, you can twist and bend from it, but it's not the best for him. You have really good mobility in the thoracic spine. You can rotate without rotating the hips. Here is the biggest mobility for rotations, and you need to use those and not compensating with the hips. So the next exercise is the same like the scorpion, but with the hands. Here, again, posterior pelvic tilt, squeezing the ass, the glutes, doesn't matter how you call it, and then try to lift the arm without moving the hips. The hips needs to be on the ground without any movement. This will engage the thoracic muscles on your back, make them stronger, and it will be easier for you to twist without compensating. And the best thing is that you have your posture better if you have strength over those muscles. So overall, it will help you not just with doing that exercises, but for the long-term fix. If you know how to do them and embed them in the real life, here comes the real good benefits you're looking for. If that video is helpful for you, just give me a comment down below, because I'm a new guy here and need your support. Till next time.